The Philippines is an archipelago in Southeast Asia with a population of around 110 million people as of 2022. Today, more than 10 million Filipinos are working or living abroad. Country records indicate that the Philippines is the fourth largest remittance recipient in the world, with around $38 billion in remittances sent by migrants in 2022. Manila is a center for most major government agencies, including the Department of Health, who provides access to health programs for all Filipinos nationwide and overseas. It is also home to the Department of Migrant Workers, whose main mandate is to protect the rights and promote the welfare of overseas Filipino workers, or OFWs. Filipino overseas migration trends reflect the socio-political and economic situation in the Philippines. Although labor migration has been embraced as a temporary measure to alleviate inadequate employment generation, observations show that overseas migration has become a long-term trend in the country.
Ako po si Lolita Valderrama Tora, 65 years old, ng Pulumulok, South Cotabato. Nakapunta ako ng Singapore 2005. Ang alaga ko sa Singapore, isang bata lang, babae. 2 months pa lang ang bata, ako na nag-alaga.
Aside from the daily challenges they face, one major concern for overseas Filipino workers is access to health insurance. While health and social security systems are in place, OFWs don't utilize these protections due to barriers or determinants of health, such as health literacy, education, access to technology, and more. The Department of Health works with PhilHealth, which is the National Health Insurance Program. They also work with the Department of Migrant Workers, which ensures that OFWs are properly briefed about their rights and benefits through various health literacy programs offered before they embark on their overseas journeys.
Mandate of the Department of Migrant Workers is, of course, to promote the welfare of our OFWs. We have so many programs that cater to the psychological, emotional, physical, and well-being of the OFWs. The very important prospects that we undertake, of course, is to provide for the assistance to all our OFWs who are in distressed condition. There is a hesitation in prioritizing health programs because of the lack of awareness of our OFWs. Their primordial concern is only to seek for better opportunities, like for better financial packages in order to provide for the immediate needs of the family. But they seldom realize that health should be their number one concern. No? The PMOS, or the Pre-Migration Orientation Seminar, is an orientation that helps the OFW to be aware of the problems and the anticipation that an OFW would be facing once he goes on overseas employment. It's very important that we teach our OFWs on how to prepare the family, especially the young ones, whenever they will be separated from their parents. In addition to the Pre-Migration Orientation Seminar on the expectation and anticipation of the OFWs, it's also very important to know what is the process flow on going through a regular and path and an orderly migration process. No? It's very important that we should know which are the agencies that they should avail of. For the Pre-Deployment Orientation Seminar, it's also very important for the OFWs to know the realities in the specific destination country.
In our service to the OFWs, we conduct several or massive information education campaign. We conduct orientation on benefits to manning agencies, to OFWs themselves, and to OFW groups. And we also had an orientation or re-orientation on benefits and PhilHealth procedures, processes. We have several programs for OFWs while they're still here and when they are already outside of the country. We conduct the PDOS, or the pre-departure orientation seminar. We also conduct the PAOS, or the post-arrival orientation seminar, to ensure that our OFWs are familiar or updated with the current benefits and policies of the National Health Insurance Program, or PhilHealth.
Well, when we speak of health literacy of the migrant workers, the Department of Migrant Workers services to the total well-being of the OFW.
Pag nasa abroad ka, kailangan mo talagang may access ka dyan sa mga PhilHealth na medication, ganon. Kailangan talaga. Kaming mga OFW, sa isip ninyo maraming pera pero hindi yan totoo. Sa sweldo pala, pagkasweldo, diretso yan sa pamilya. Kaya kailangan namin talaga ng ganitong mga programa ng gobyerno natin, ng PhilHealth. Malaking tulong yan talaga sa amin. Nung nakapag-enroll na ako, parang at least nabunutan ako ng tinik. Dahil at least para may security na ako sa aking sarili. Na magkasakit man ako, anytime, para nakasandig na ako sa pader. At least kung may PhilHealth na tutulong sa'yo, alam mo na hindi ka masyadong mahirapan.